related. And there are a lot of gray areas where you have to work through and you have to come to this determination. Okay. Why? Because if you are working on oncology clinical trial products, the patient, the subject, what you are getting may not be having simple clinical scenarios like how we are trying to explain for understanding purpose. Okay. So this patient might have got coronary heart disease, or he might have got renal failure and stage renal disease. Like that, there will be lot of past medical histories, and he might not be taking this only suspect drug. He might be taking a lot of medications. Okay. So along with that medications and along with his past medical history, and if you think that this suspect drug could have caused this adverse event, it's not an easier thing to do. Okay. But through practice you will be able to get a hang out of it. Okay. Once you have a good product knowledge, and once you have a good medical background, and if you are able to determine that without any other explanation, this adverse event is caused by this drug, then you can say that causality is related or not related. Okay. So there might be a lot of gray areas to come to this conclusion, but it is not an easier approach in your earlier stages. But in later stages, you will be able to definitely perform it in a better way. Now, coming to the scales. Okay. There are three commonly used scales to assess causality assessment, but these are not used in our 9 to 5 work times. Okay. These can be used when you're writing an article, or sometimes in interviews. Few interviewers might ask you that name some scales to determine causality. In such situations, you should know about these scales. Okay. The most commonly used scale to assess causality is WHO's scale. Okay. If you want this, you can download in UMC. Okay. Ursula Monitoring Center website. There is this WHO causality scale. Again, I will be explaining in the next slide. Okay. And then Narinjo scale for EU, and Ailes algorithm, and Bradford Hill criteria. Okay. This is done for pharmacoepidemiological studies. Okay. These are few scales that are used to assess causality assessment. So coming to this WHO scale, it might appear Greek and Latin to you. You might just try to be with me so that you can able to understand that what is given in this scale. Okay. Say for example that in this WHO causality assessment scale, instead of saying as related or not related, previously they used to mention that certain, probable, possible, unlikely, conditional, and unaccessible or unclassifiable. These are absolute nowadays in your day-to-day practice, but for understanding purposes, we try to explain in this class. Okay. So certain means you have to reduce one from all these criteria so that you can come with certain, probable, possible, or unlikely. If you know that because of the mechanism of action of the drug, this adverse event is causing. Okay. That is one criteria. See here as event definite pharmacologically or phenomenologically. What does that mean? Means that you give a drug because of its mechanism of action, it can cause an adverse event. Okay. Next is can't be explained by disease or other drugs. This is what we are trying to explain, that without any confounders. Okay. Or any alternative etiologies that could have caused that adverse event. And then response to withdrawal plausible. So what does this mean? Means that once you give a drug, it will exert its peak action at a particular point of time, and then once it exerts its action, it will be eliminated. We mentioned this in pharmacology as pharmacokinetics. Okay. What happens with the drug in the body? So we will just be having that bell shaped curve, and in that t of whatever adverse event happens, we assume that it is because of this drug, because the drug is within the body. We call that as temporal association or biological plausibility. Okay. So with the time of administration, and if you know the half life of the drug, within that half life, if the adverse event have happened, you mentioned that as it is related. Okay. And re-challenge satisfactory.